the completion of the final progress report for the VIS project. This is the first dashboard that I had earlier created and I have shown in the progress report. So I completed this. Here I have integrated brushing with the MDS plot with the parallel plot. So you can just select points in the MDS space and the corresponding points will be plotted in the parallel plot. So you can see these are the individual procedure costs, and because we have selected three facilities, we can see lines in three different colors in the parallel plot, and you can see we can find out what are the names for the selected facilities. So this is the brushing implemented between the MDS plot, which is the cost in the high dimensional space, and the MDS and the parallel plot, which shows the values of each individual dimension. We can use this to compare like outlier points and see. So you can see like the outlier has much higher cost at all the points as compared to the other one. So this is how we can actually compare points. We can also zoom in and zoom out to capture like 2 points which are very close together if we want to compare them. So this is what we can do. You can actually zoom in, zoom out. You can hover over the facilities to see what is the name. So this was the completion of the first dashboard that I was building. I built a second dashboard which visualizes the discharge data from hospitals across New York. So this is a combination of all these different data points. The first one is like the medical procedure for which the patient was admitted. The second is the diagnosis of why the procedure was needed. The third is the age group, which was like the age group of the patient. The facility name, we have gender and days of hospitalization. So basically on this dashboard we can run interactive queries which combine these data parameters. So if you want to find out for males in the age group 30 to 49, what were the procedures performed, so we can see the procedures performed. The top among them was alcohol, drug detox. We have other therapeutic procedures. We have spinal fusion. The diagnosis of why these procedures was performed, the top five reasons for like alcohol related disorders or substance related disorder, which makes sense because these two are the reasons for the alcohol or drug detox. You can also see it took the maximum number of people, it took 1 day of hospitalization. We can see Strong Memorial Hospital is a hospital where max number of people were admitted. So we can reset these filters by clicking back on them. We can deselect the age filter, we can deselect the gender filter. We can also do a different sort of a diagnosis that supposedly we want to find out if somebody has septicemia, then what all are the procedures that are possibly done on the patient having septicemia. So we can see respiratory intubation, we can see catheterization, or we can see blood transfusion. So basically this is also like a tool which can help diagnose what are the possible treatment options. And so this is also like a sort of a differential diagnosis tool if we want to do a population study, like if what are the things affecting 70 to 9 70 people with 70 years of age or older. So you can see for these people the diseases, the procedures change. They undergo blood transfusion, they undergo gastro or biopsy. You can also see the the reasons of why this was done was changes. So you can do all these sorts of studies using this dashboard if you want to see what are the procedures that are performed especially for females. So you can see C section is at the top of this reason, and the diagnosis is the live born. So this makes sense. So you can do all sort of studies on this. You can also combine multiple queries by clicking on them. If you want to see what is what are the procedures for which we require 5 days of hospital admission, so we can just click on this. We can see like alcohol, drug detox, blood transfusion takes a lot of time, so does C-section. And yeah, so this is what it is.